or snapping of these joints, that we get to the chiropractor as soon as possible, so that when I adjust a child that's been in sports or has something going on, falling off a horse, or God forbid, falling off the bicycle, we check for linearity in the way the spine moves, which means we want to make sure the spine all through the child and the adult's life is sharing the load of work through space evenly. We don't have one section of the spine doing more work than another section. That's already intimated somewhat by the way the shape of the different sections of the vertebrae are, but mainly you want to have that when a child comes in, usually when they fall, I'll usually find one of these knuckles sprained out of smithereens, and it's not, so I'll close it down so it can heal. And I always tell the parents, call me any time of night. We've got to get to it as soon as we can. As soon as that knuckle sprains, we want to put it back together as fast as possible in the middle of the night, whenever it happens, in the evening after the sports games or whatever. You want to be able to put that joint right back together as fast as possible. You don't want it spending any more time, let's say, out of place than it has to. You want to, so the chiropractor comes down here with his hand and he examines the spine, and he can put that spine right back into position, home position we call it. So don't forget that. So pretty much, if we saw every under 18-year-old for one generation, we would stop all back pain, or 99% of back pain problems, because it all happens because of an injury in sports, or falling off a swing, falling off a bicycle, and then that stays there, and then you hear about it in their 20s and 30s. Oh, there was that time I got hit back when I was 10 years old, 5 years old, fell out of a tree, whatever it is. So we've got to train or teach the community that chiropractors are there not just for therapy. It's not a therapy, it's an adjustment. It's made to maintain the alignment, sort of like you do with your car. You don't wait for the engine to blow up and then go get treatment. You try to take care of it and make sure it's lined up so that it can have a nice long lifespan. Same thing with your teeth. The teeth is a good analogy. You take care of your teeth so they don't rot or they don't get cavities. You don't wait for the cavity and then go, oh yeah, I go to a nice cavity doctor and he massages my cavities or whatever. No, you want to use good toothpaste and good hygiene to take care of the teeth before they develop cavities and problems. Same thing with the spine. We've just done a poor job of teaching the public or how to take care of the spine. Most of it is preventative. And then of course, when the patient does come in with a ruptured disc or something, you don't go twisting and popping on that ruptured or damaged area. But that seems to be what we take from the medical community on how they treat problems, right? You break your arm, you work on the broken arm. That's what you do. Well, when you sprain these knuckles in the spine, you don't necessarily have to work on them directly. You close them and align them, but the therapy doesn't apply there. You work usually up and below and above where the injury was. So now it gets a break. It gets a rest from where it is. So that's what we have to teach, is preventative, or before the ruptures happen. Once the ruptures happen, there's not a lot we can do. They can put some electricity on it and put some lasers on it. It doesn't work that well. You've got a permanent trauma. That's why I always say, when the child falls off the swing or falls off the bike or the horse, that's a permanent injury. And unfortunately, we failed the child at that point in time, let them go into a dangerous situation. Maybe we can stop that, but they're going to have to understand, if you're going to ride horses and ride mini bikes and motorcycles and BMX bikes, you're going to have some permanent injuries that are not going to be able to be reversed. And therapying them with a therapeutic model doesn't work. Putting it back in place as fast as we can, just like when you break a bone. You don't want to have the bone heal broken for a couple days and then have to re-break it and bring it back in. So as soon as these injuries, these sprains, falling off the devices or whatever, get to your chiropractor so that they can put the spine in alignment as soon as possible, so it can maintain its life in that good alignment. And that's the best way I can try to prevent. I wish somebody had done that with me. I fell off the horse when I was in 12 or 13 years of age, and that's the way it healed. And then by the time I'm 25, this low back is destroyed. It's gone. So any questions, feel free to type me and let me answer your questions, make a video about it. This is Dr. Bo here. Like and subscribe. Thank you very much.